Europe faces a lot of new challenges in the area of health policy. We have an aging population, we have new diseases, we have stress in the financing of the health systems. So modernizing and innovating all around the healthcare is a must. And I encourage everybody, the doctors, the nurses, the hospitals, the researchers to go forward with new instruments and better tools. And I think innovation in the health system is just a survival kit for many citizens, but as well for the decision makers and the politicians in Europe.
Well, in effect, innovation is the vital way forward for health. We cannot move forward in health without innovation. We have to change our mindset, we have to change our processes, we have to change the organization of health systems, and we have to be prepared not only to accept these changes, but also to commit ourselves to make these changes.
What's really emerging already for the technology is that there's a need for technology push and pull. That means that we have existing technologies today that needs to be made better. And a good example is the sequencing, where the cost is going down and down and down. We identified three key areas. One is standardization. A second one is the integration, and a third one is the harmonization. And to give you an example for harmonization, we could talk about the regulatory framework in Europe, one example of which is probably the lack of regulation right now for diagnostic tools, or even in the collection of samples of data for biobanks.
Our aim with Health 2020 is to improve health and well-being of the population of the European region. And as all the determinants of health and well-being lie across the whole society, it is quite important that our interventions also lie across the society, which needs a totally new way of thinking and a new way to governance, to health, which is more horizontal and much more participatory.
We all know that the budgets are now under pressure. Therefore, decision-making in innovation and health is going to be associated and driven to a very large extent by, well, what's this going to cost and what's the return going to be? And there's a huge obligation, I suppose, on the scientists that are now doing so much good work in health to convince the ministers for finance in Europe that there's a good return on the investment that can be made in relation to health. I believe that is the case.
If we are meaning innovation financing system, we are talking about how to bring more money to the health sector. We have some risk that of imitation of innovation, and of course it will be very complicated for us if after 5 or 10 years we must revise our innovation. This is also risk for population to get some new channels of financing health system and pay bill through the other sector of our life.
Firstly, in the area of e-health, which is my speciality, you can't just buy kit and software and gain productivity. You have to buy kit and software and change the practices of health professionals, hospital systems, and local authority cooperation. So absolutely reform, i.e. change in a good sense, and underpinning e-health systems go together.
It is important that we involve all stakeholders from the beginning, including the patient. And of course, as we generate a lot of data, we need also to make sure that these data are secured, we have data protection, but also we share them at the same time. And that we may have a great potential coming for our next generation in better life and healthy aging.
I think that within Mothers to Mothers, we work to empower women. We work to empower women specifically living with HIV. I think it will be empowering for them to hear that there's an audience in Europe that's listening, that's aware of their efforts, and is looking for ways of applying similar efforts to the European context. I think that alone will be meaningful to them.
I agree that information technologies are the future of the medicine. But let's think about doctors who should at the same time to adapt them and have a lot of other duties. And think about patients who always would like to have contacts, more contacts with doctors, not with technologies. So think that never technologies will change doctors. Think how doctors can work in such a difficult situation.
Don't forget to involve the patients when you are designing the innovation, because they are the users.
Innovation is first and foremost about the people. And innovation has to reach out also to the most vulnerable and marginalized groups of the society, who often have the most urgent health needs, but those needs are way too many times overlooked. One of such programs is the Roma Health Mediators program, which connects the marginalized Roma living in Europe to the health systems of their respective countries.
Well, as you know, with today's context, older people are more and more going to be asked to actually cover part of their costs for health and long-term care. And with their reduced resources, they're really looking for a leadership, political leadership, to find solutions that work and will deliver the best value for their investments. Well, innovation that will really make a difference in older people's life. That means bringing solutions that are valuable for them, that really answer their needs. This is what is missing maybe sometimes still today.